Hi everyone, and welcome back to my channel, Dr. Coco's Medmonics. Today I'm going to be going over kidney stones, and I can tell you right now kidney stones are so very high yield. Pretty much like every MBME that I've taken has done some kind of question on kidney stones. So let's get started. General rules to help you out. If the stone name has the word phosphate in it, so like ammonium, magnesium, phosphate or something, then they're going to have a higher pH environment, and that's not because of the actual phosphate itself, but that little like rule kind of helps because there's only two that have the word phosphate in it, but those are the only two that have a high pH. And then they're all going to be radiopaque except for uric acid, which will be radiolucent. And so if you can remember U in uric acid for radiolucent, that can help you as well differentiate that one from the other kidney stones. So first we have the calcium oxalate stones. This is the most common kidney stone, and they say that it looks like an envelope. I don't really see it, but if they describe an envelope shape, then you know it's a calcium oxalate. And if you need a way to remember this, I always think like envelopes are in everybody's house. It's super common, but also you sign your letters with XOXO for oxalate. If you're ever have a question, you really don't know what the kidney stone is, a safe bet would be calcium oxalate just because it's the most common. Then you have calcium phosphate, which is a wedge-shaped prism. And I always think phosphate has the high pH, but also phosphate, you fuck your fate for phosphate on a wedge-shaped bed. And I remember when I was studying this, I was like, what the heck do they mean by wedge-shaped? So here's a little picture of a calcium phosphate stone. Next we have ammonium magnesium phosphate. So this is another one with the word phosphate in it. So it'll have a high pH. And this one they like to describe as a coffin lid. Again, I don't understand who comes up with these. I don't think it looks like a coffin lid, but here we are. And this causes Proteus staghorn caligulae as well as Klebsiella. So if they ask you, like what infection this person had with an ammonium magnesium phosphate kidney stone, or they show like a staghorn caligulae, and that one actually does look like the horns of a deer or a stag, it's either going to be Proteus or Klebsiella. And I originally knew Proteus really well, and I was like, oh yeah, it's Proteus from the Sketchy, and it was like a weird lizard dude in a bathroom or something. And if you need help remembering the coffin, part of me just remembers that Sketchy and thinks, well, maybe he's actually a ghost, because that Sketchy was kind of weird to start with, so we're just gonna go ahead and make him a ghost, and then that's for the coffin. But I also remember Klebsiella. I've had a question about that where they didn't give Proteus, and I was really upset, and I was like, well, I don't know, it's Proteus, but Klebsiella can also cause ammonium magnesium phosphate stones. Next we have the uric acid stones. This is the I believe this is a mnemonic from first aid where they spell out uric acid. This one, again, we're talking about the radiolucent for U and uric acid. They're a rhomboid shape, and I don't know who remembers crap from geometry. I didn't, so I looked up what a rhomboid was. And here it is. They are invisible, or minimally visible, which helps you remember the radiolucent. And this one is really common that you'll get a question about cell turnover. And if you can remember where cells like break up and different things go up or down, and it's called tumor lysis syndrome, uric acid gets released, and so that kind of helps me remember, okay, if we have like a tumor lysis syndrome, that's where your cells are getting like broken up and things are being spewed out of the cell, and one of those things that increases is uric acid, so we could make a uric acid stone. Just from us trying to excrete that excess uric acid. This is obviously going to be correlated with like other syndromes with high uric acid, so gout, Leishman, things like that. And last stone we have is cysteine, and I'm not really sure where I remember this mnemonic from, but if you can remember that a 16 and a hexagon has 6 sides, as well as 6 sick kids drink cyanide. And so this is the 6 in 16 is for the hexagon shape. The sick kids is to help you remember that this is a hereditary condition, but also cysteine stones are pretty much always in kids in the question stem. And then drink cyanide is for the sodium cyanide nitroprusside test. And so if you get that sodium cyanide nitroprusside test, that's a key giveaway that this is going to be a cysteine stone. Hopefully this video helped you. Kidney stones are very, very high yield. I would know these like the back of your hand. Also know that if you're trying to prevent calcium stones, I would definitely recommend giving a thiazide. That is another high yield topic that shows up a lot. And if you like this video, please subscribe to my channel. This is Dr. Coco.